Hi, Ms. Flores. I'm in the Wednesday 8 a.m. lab group. For today, I'm doing my IM influenza vaccine injection. Before I would walk into the med room, perform hand hygiene. I would then go to log in and retrieve items. It is for our patient Millie Larson. I am withdrawing the influenza vaccine, 2.5 milliliters. Just check out. Yes, I am drawing one. Press to retrieve items. We would withdraw. Over I would pull out and do my first med check of influenza vaccine 05. Yes, it does check out 0.5 milliliters. That works. Remove. And then I will also at that moment grab my 1 milliliter syringe, as it is 0.5 milliliter withdrawal, so this would be fine and appropriate, along with my 23 gauge needle that's appropriate, and some alcohol prep pads. And then I would continue to log off. Go over here. I will then knock knock, introduce myself. I'm Ms. Larson, my name is Colin. I'll be your nurse today. Just before we get started, can you confirm my name and date of birth for me?
January 31st, 2002, Millie Larson.
All right, thank you so much. So what I'm saying, I was going to give you a shot. It's through right here, and it's just your influenza vaccine. Is that be okay with you?
Yes.
All right. Then you don't know any known allergies I should be made aware of before I do this?
No, I don't.
All right, thank you. And so right now, before I would withdraw, I would do my second med check of influenza vaccine. Yes, I will pop up and be true. I'll check cells over 5 milliliters, and then gather my supplies. Before I would do hand hygiene again. I would then need to grab my gloves. Put my gloves. I already got the allergic, checking out, name and birth confirmation. I would then get my stuff prepped. This.
Oh, yeah. Yeah, can we use that? Is it charged?
Insert my lock.
Yeah.
Just clean, I could sit down.
I'm so
Before I
sorry.
administer. I would clean the vial. It's okay. Clean the vial. Clean the top of the vial.
Wow.
And then get ready to open the lock right here. And I just want to aspirate 0.5 milliliters. That is what I'll be injecting. Right here. Lock. Insert. And I would get my needle.
I'm anxious to see this.
Aspirate. And then withdraw 0.5 milliliters. Draw. Then I would scoop. Checks out. And then from there, I would do my third med check of influenza vaccine. Yes, it does check out influenza 0.5 milliliters. It does check out. Alright, so I'm going to inform the patient what I'm about to do. Before I do, I'm going to assess the site and look for what I want. I will be upper deltoid looking right here. Yes, the site is clean where I want it. I will squeeze. And before, I would clean the site. Clean the site. And then I would uncap. Ready. And then I would squeeze the site. Pull for what I want. Straight at 90-degree angle. Inject. Pull straight out. Apply any gauze. Recap safely. Put it right here. Any gauze are bleeding if necessary, and I ask them how they're doing to reassess them, let them know how they're doing. And I would take off my gloves and I would document the procedure, and that would be it. Done.